When you feel it in your hands, you'll know what it means to use the Surgibit. My name is Bill Walsh, and I'm a professor at the University of New South Wales and the director of the Surgical and Orthopedic Research Laboratories here in Sydney. I have close to 30 years of experience in biomaterials and biomechanics as it pertains to orthopedic, surgical, spine, and musculoskeletal research. Today, I'd like to discuss with you the importance of drilling into bone and how the instruments that you use to enter into the bone can play an important role in the success of the implant, the fixation, and ultimately the clinical overall success. When we look at the design of drills, a lot of it is taken from the metal and woodworking industry. And that's where the Surgibit really begins to differentiate itself, because the design of the Surgibit, which is a unique geometric shape that covers both 2 and 3 fluted drill designs, allows the surgeon to enter into the bone in a controlled manner to minimize many variables that have been known to be negative for bone healing. The Surgibit has a long lifespan, which differentiates it from other drills. It's a high quality, grade stainless steel that is a very hard material, so it can withstand multiple drill episodes without losing its sharpness, losing its ability to target at the time of the procedure. Whereas with other standard 2-fluted drill designs, we see damage to the drill even after only a few usages. As you drill from the medial cortex, and as you enter into the lateral cortex, the drill doesn't bend because it again targets on the far cortex. And so those 2 holes are basically in the same plane. Obviously, when you drill, you have to be aware of your feed rate or your thrust force, the axial force that you're applying to the bone, the rotations of the drill itself, and if there's any irrigation at the site. And all of these are factors that the surgeon can control. And when we consider how bone gets hot during drilling, what we have found that the Surgibit minimizes thermal necrosis because the temperatures during drilling are lower. The pyramidal tip of the Surgibit enables you to target, and you can literally drill at any angle that you want without actually having to change your trajectory. The accuracy of your hole could dictate where your hardware goes. And this is even more important when you're actually trying to drill across the tibia or the femur to lock a screw. It doesn't skive off curved surfaces. The Surgibit is protected through a wide range of patent portfolios. Well, the real next step is to use it. Try it yourself. See how it feels in your hands. Enter the bone with the Surgibit. And I think once you do, you'll change your opinion. I'll leave you with this thought. The next time you're in the operating room or the operating theater, and if you're operating with your resident or your registrar or one of your trainees, teach them how to drill into the bone. Pass on your knowledge of the importance of minimizing tissue damage, minimizing thermal necrosis, and use the instruments that can help you achieve this. Because ultimately we want faster healing, and better patient outcome.